healthcare providers can get new patients continuously without adding cost and complexity. My name is Alon Bender, and I am the founder of AICareXpert, the developer of AICareXpert, which we are going to talk about. A little bit about myself before we dive into the topic here. I've been in the tech industry over the last 20 years, working with some of the largest companies in the world, based in the US, such as McKesson, Boeing, Chevron, eBay, and many, many others, selling $85 million of projects where I hands-on design and deliver those projects. And using all of that experience in the last couple of years with AICareXpert, we focus on a way to utilize AI to help healthcare providers such as yourself to gain new patients, improve patients' experience without adding any complexity or cost. A little bit about AICareXpert, a Miami-based company, US-based company. As I said earlier, we specialize in AI automation solutions and analytics, and let's just dive right into it. One of the biggest megatrends in AI is actually in healthcare. So healthcare over the next 5 years is going to grow rapidly when it comes to utilizing artificial intelligence, from $20 billion a year this year, 2024, to $148+ billion a year over the next 5 years. So that's a rapid growth. Now, we take a very responsible approach to AI and how AI should and could be used in healthcare in a way that is responsible and brings clear value now by focusing on growing care without increasing the cost and complexity. And that's really what we are going to focus on in this overview. So let's just dive right into it. So healthcare is changing rapidly, and with those changes and with those opportunities and with that growth within healthcare, obviously there are challenges because not everyone will be able to scale to the same level as others, and we're going to talk about exactly that. So the first question I want to ask, and this is based on working with healthcare providers, frankly, globally, not just in the US, and we hear from everybody that they are experiencing staff overload, which leads to reduced patient engagement. So if that sounds familiar, that's probably not a big surprise to any of you watching this video. So staff time constraints and overload is a major issue that is also impacting turnover and the fact that you need to look for new employees, hire, onboard, train, maintain, etc. So that has been definitely something that is felt throughout the healthcare industry. Some of the other challenges that are result of having staff that is multitasking and is doing many different tasks, some of which are operational, back office related, some related to patient facing, etc. That creates communication challenge with patients, which leads to mainly to certain level of frustration and receiving inconsistent information because all of that. So patient experience and satisfaction leads to basically means that wait time may be longer and the level of engagement can't be very high, and that's definitely a challenge. Stress and burnout leading to turnover and the need to train and onboard new staff, that's obviously a challenge by itself. So the question is understanding where most are today with limited resources, and the definitely high growth niches within healthcare, and Those are listed on the screen right now. Some of them include telemedicine, one of the fastest growing sub-niches within healthcare, home healthcare, mental healthcare, health and wellness services, genetic testing, etc. I'm not going to go through all of that, but basically outpatient healthcare providers of all kinds are experiencing huge opportunity. And now the question is, how can you take part in that rapid growth? And if you are not growing, then you may want to ask yourself, why? What's the reason? And what can you automate responsibly, because this is healthcare. So there are things that we are not going to automate, even if technically some areas can be automated, doesn't mean that they should be automated. That's the responsible part of automation. The risk of not keeping up with your industry, whatever niche you're in, as a healthcare provider, is obviously staying behind and missing on opportunities. And that's definitely not a good thing, especially if part of your offer or services is based on services that do rely on technology or do rely on your ability to adapt and use modern systems and modern tools, etc. Frankly, just to be able to keep up and to capture definitely some of that growth. So now the question is, so where patient engagement breaks down, even if you have great online presence today, which means you have a website, you have social media presence, you may be running ads on Instagram, Facebook, Google, etc. And that's standard. So if you don't do that, you're probably behind on some of the basics. But most of you, all of you have websites, so you do have an online presence. Some are more active than others. Some may have in-house marketing department or marketing team that invest more resources, time, energy, and funds to maybe generate paid traffic and so on. But the question is, so you have all of that. So where does it break down? Where does the engagement with your new patients, attracting new patients, where does that breaks down? So it breaks down, going back to what I mentioned earlier about staff being overstretched, overwhelmed, multitasking, doing so many other things that frankly are more within their main responsibility. They don't have time to really engage with new customers, new clients, and handle large volume of inquiries effectively without impacting the other things that they are doing as their main primary priority at your practice. So the first question is, do you have staff bandwidth to increase online engagement? So why is that important? That's important because we see in 2024 that 70 to 80% of individuals use the internet to gather information on treatments, on health issues. So this really becomes the standard. So what do you think happens when someone starts their research online, they land on your online presence, and there's no engagement, meaning they are maybe not ready to fill out the form, and we'll dive a little bit deeper into the patient journey. What does it actually look like? But that's really what I mean by your engagement, patient engagement starts to break down because it's very static. So unless they go all the way to contact you while they're still on their journey, or discovery journey, to understand their options, do their own research, and that's the vast majority of patients, there's really no interaction, even though you do have online presence, but it's very static. And we'll explain that shortly. So when we think about the patient journey. What does it actually look like? So and this is really a marketing funnel. That's the other way to look at it, because that's what it is. So according to CDC, majority of individuals begins their health information journey online. Not a big surprise, as I mentioned earlier. But what does that actually look like? So this is what it looks like. So 60 to 70% start by seeking information. That's what is called the awareness stage. So they're not ready to contact you. They're not ready to schedule an appointment, but they just start to understand what treatment options there are, what's out there, and they may be doing a research for someone else. A wife may be doing a research for a husband or boyfriend, or vice versa, and that's really where it all starts. So at that stage, even though they may hit your online presence, your website, they're not likely to be ready to make any decision as far as scheduling an appointment, whether it's a paid consultation or not. The next category is engagement. So out of those, really from that 100% bucket, 20 to 30% have deeper interest in treatment options. So now we are getting closer to, okay, they start to do the discovery, start to collect information, see what options they have out there, but now they want to get much more specific. What lab tests are available, things that are a little bit closer to them as they're getting closer to really making a decision to take an action, but they're just shy of taking an action. So that's really what is called the consideration phase. The last phase is really evaluation and decision. So evaluation and decision. So when a patient on their journey reach the point where they are really ready to evaluate their options, this is most likely when they are ready to talk to someone from your office and start the conversation, maybe a consultation, maybe an appointment, paid or not, based on your policy. And only 5 to 10% are going to make decision on their treatment selection and which healthcare provider they would like to work with, etc. So that's really the decision phase, and this is where you start to convert new patients. Now, with the AICareXpert, which is our AI solution for healthcare providers, we actually focus on the 80 to 90% that are still in the awareness and consideration stages because of few things. One, that's the vast majority of the people that engage with you, with your practice online. You don't see them. Today, you don't even know what they're looking for, what they're asking for. So if there is a way to start to serve those numbers, the vast majority, then this is really what we do with the AICareXpert. And that's very significant because now you separate yourself from others. You are able to start to demonstrate value under your practice name as a healthcare provider by helping the patient as they go through their journey from step one, and not just wait for that last 5 to 10% that are ready to make a decision. That's a much easier conversation, but that's not the vast majority. So if you are looking to scale up and you're looking to grow your practice, this is the best way to do that, by focusing on the vast majority of people that are actually interacting with your practice, where you have really no way of communicating with them effectively. Today, you don't have the bandwidth, you don't have the visibility, and that's really what AICareXpert does. It unveils that those patients or potential new clients, it engages with them throughout the entire spectrum of the patient journey, and not just at the last step where they are ready to schedule an appointment, which is the last step. So now the question is, okay, that's great, but there are already all kinds of solutions out there that healthcare providers are using. So why those do not work, or what's the difference between those and what those are? So what are the available options today? The most common one is a web form. So the vast majority of healthcare providers, they have a website with the form, and basically you're inviting the patients when they start with the discovery process and consideration to click on that schedule an appointment. It's really the same as asking someone to get married on the first date. It's just not going to happen. And it's not going to happen with 90% of the people that landed on your healthcare provider's online presence on your website. And that's a big miss. That's a huge miss. So that's why this web form is great. It's important to have. It's better than nothing, but it's really not effective, because that's only fine for that 5 to 10% that is really ready to make a commitment, and that's not how we are going to convert more new clients and scale. The second one that is used out there by healthcare providers is what is called a support agent. So a support agent, basically, there is a chat window that pops up on your website, and that pop-up window invites basically the visitor on your website to fill out their details and start a conversation with the support agent. It's really an outsourced service. It's a human during business hours. So there are a few problems here. One, you're asking for the details again. It's another form of basically filling out a form. They're not ready to get married on first date, and you're already asking them a lot, okay? When I say you're asking them, going back to the patient journey, this is 90% of your visitors. So you deter them away. So no one is going to give their phone number and email while they're still in research mode. So you have zero interaction with the vast majority of your potential patients. And number two, this is dependent on a human agent, someone that is not working for you. This is outsourced. So it's a little bit more scalable, but their knowledge is based off of a script, off of basically a document that your practice shared with this service. And there's a person that goes through a script, and that's really can be a great experience. And you have very limited ability to train and transfer knowledge even to that support agent. All that support agent does is, if and when they actually get someone to communicate with them, they're more likely already people that are about to make a decision, then they basically just have a very basic communication and try to schedule them basically on your behalf. It's just another type of form, and it's not multilingual, it's human-based, it's typically during business hours. If you want to run this service 24 hours, which means 3 shifts, it can be quite expensive. And it's limited by the human that provide the service. Another form is less common in the US. It's more common outside of the US primarily for compliance reasons, but it does exist, and that's a messenger. So some healthcare providers, primarily, like I said, outside of the US, in the Middle East, in Latin America, where WhatsApp Messenger is prevalent, they basically embed the messenger, so they allow the visitors on your website to click on that messenger, and that messenger then basically contacts someone in your office. So one, you need to have a person, a staff member in your office that is going to respond to those inquiries. And two, that's typically only during business hours. And three, your staff is busy doing other things. And four, you assume that when the visitor sits on their computer, they have WhatsApp installed on the desktop, which is very rarely the case. Most have WhatsApp on the mobile device, not on their computer, even though there is a web version. So that entire experience is very limited and it doesn't really scale. It's just basically, again, targets the 5 to 10% of patients throughout the patient journey, and still puts another task on the plate of your staff. Not very effective, absolutely not scalable. It's not multilingual unless the person that answers those chat requests speaks more than one language and can answer that response, etc. So these are basically the alternatives today. So before we dive into AI, let's address the elephant in the room. I just a couple of weeks ago, I came back from the HIMSS conference here in South Florida. It's an annual conference in healthcare where leaders from the healthcare industry, primarily from Florida, but not only, we're discussing the implications of AI in healthcare technology and some of the perceptions around the AI in healthcare. So I wanted to address that before we go any further. So let's dive into that. So the first perception is that AI is trying to replace humans, which creates all kinds of problems, especially in the US, around compliance and privacy and some other things, but most of all, imposing a risk of potentially giving the wrong medical advice. And we don't want AI to replace the medical team, the medical professionals, the doctors, and definitely we don't want AI to provide medical advice. So when we build AICareXpert for healthcare and only healthcare, we actually design it as what is called responsible AI, which means that by design and by definition, AI care expert is not allowed to provide any medical advice. So what it does, it's basically answering general inquiries around the programs that you offer, the treatment options, things that are not personal to that person, to that potential new patient, and do that in multiple languages 24 hours a day with a huge knowledge base, so it can answer basically any question under the sun, including questions that are unique to your practice. We have the ability to train, but short of providing medical advice, actually what it does, it encourages the patient when they pass certain point or they ask questions that do require some assessment or they cross the line into medical advice, the AI will encourage them to contact your practice and to schedule a consultation appointment. It will not attempt to replace any of the medical staff, and that's extremely important, especially in healthcare. Another one, few other perceptions here, cost versus value. So the reality is, and we have different cost structures, and I'm going to cover that in more details in a couple of slides here. But AI, the way it's designed, it's extremely affordable. And with AICareXpert, based on our experience working with other healthcare providers, it pays itself within basically days. So once you deploy AICareXpert, it will start to generate new clients, new patients for you, new appointments within days. It all depends on the amount of online presence that you have, but our experience is that you see an immediate return. So by the time you will have to pay anything for the license, you will already enjoy new patients, new revenue, and lots of benefits from AI. So basically the value with AI is extremely high, and I have some tools and numbers that I can share with you based on our case studies with existing customers. Complexity. Another perception is that AI is very complex. So when we built the AICareXpert, we took that into consideration. So we made it so simple that it's designed for ease of use. It's very user-friendly. We do all of the heavy lifting on the back end. So from your perspective, you don't have to. It takes literally few minutes, 5 minutes for your web admin to deploy our AI, and we stand up all of the system on the back end, and we also have integration into your existing CRM and other tools, whether you use Office 365, Google Sheets. We integrate with all of those natively, so you don't need to change your staff. Really, they don't need to change the way they work. They don't need to learn another system or anything like that. And we are still able to provide huge amount of value, which is unique to the way AI work, addressing the patient journey, 90% that the patient journey that you are missing today. Another perception is that AI can be very robotic and not sensitive, especially in healthcare, to be able to handle human emotional states when they obviously have some feelings when they are considering treatment options, or if it's related to mental health, or they are seeking a detox program, fertility. There are many use cases, all of which require us to remember that we are dealing with humans, and we don't want AI to take over those type of conversations while sounding very robotic and cold. So what we did with AICareXpert, we actually incorporated emotional intelligence. So this is not just regular conversation, but we built a system that is able to detect the emotional state of the patient in real time and to adjust the conversation, the responses back from AI to the patient based on the state of mind of that potential patient of yours. So I'll give you a quick example, and I have actually detailed examples from customers I'm going to show you shortly. A quick example would be someone that may be upbeat, excited about the potential of becoming a parent, if we are thinking about fertility treatments. And if the responses from AI to that person will be very factual, very dull, very blunt, then that's the discrepancy that may lead human to feel that whoever they are communicating with, it's a bot, it's a robot, it's a virtual robot, is not human, and they feel a complete disconnect. So for that purpose, and because of that, what we did, we built the emotional intelligence capability into AI in real time, so that when a person is upbeat, the responses back to them will be upbeat as well. So the type of language will be language of high energy, encouragement. So there will be the same energy level as the patient in real time. In addition to that, all of that information is also stored so that you can see reports on how the emotional intelligence part of AI was able to detect the state of mind of your future patients as those conversations were taking place. And there are lots of interesting insights that you can use that information for. Another perception of AI is there's a fear of losing the personal touch. Again, especially in healthcare, as a medical staff, you do want to have personal touch because it's very personal to the patient. We're dealing with humans, and nothing can replace a human interaction, and we are not trying with AICareXpert to replace the personal touch. So the other way to look at it is really what AICareXpert does. It enhances your existing personal touch by automating some of the benign inquiries, general questions about program, treatments, availability, locations, scheduling, all of those type of interactions, while still allowing you to take over when the time comes, when they are ready to become that 5 to 10%, and then it's all under your direct touch, and this is where you can employ the personal touch as it's pretty common. Uncertainty about ROI. So another perception is that it's not clear how you can measure and know that AI works for you and that the AI really generate enough value. I covered that briefly earlier, but we do have a very detailed view into that. I'm going to dive a little bit deeper later. But really, what we did with AICareXpert is we give you the ability in real time through a dashboard, a web dashboard, very simple dashboard, to see exactly how many conversations are taking place, how many people opt in to communicate with AICareXpert, and how many are turning into engagements with your practice, meaning scheduled appointments. So all of that information is transparent. So you have 100% visibility in real time, 24/7, exactly what AI is doing for you. So it's very easy to measure because it's so transparent, to measure and see the return on that type of investment. And I'm going to show you what it looks like. So speaking of showing you what it looks like, this is really what it looks like. So on the front end, so on the mobile device, what you're seeing on the right hand side, by the way, this runs on any device with the browser. So it runs on a mobile device, on desktop, iPad, any device connected to the internet that has a browser, which is all of the devices. So what you are seeing on the right hand side is really what AICareXpert looks like to your patients. It's really very straightforward, very friendly. It's user friendly by design. We want to keep it very simple. It's basically an add-on that sits on top of your website and encourage the 90% to engage. And through that engagement, it offers to provide information, schedule consultation, watch videos. We have the ability to embed multimedia, whether it's images, YouTube videos that may walk them through different scenarios, such as an overview of the hospital, or overview of the lab, or anything else, or even a kind of a facility overview. All of that can be embedded into this AI-powered chat experience. So this bot sits on your website, and on the back end, on the left-hand side, what you see is the patient engagement dashboard. So AICareXpert, while it starts to engage with your patients, that 90% that we are trying to engage with, all of that activity is being recorded in real time. You don't have to sit in front of, obviously, the dashboard, but at any point of time, you can pop in and you can see exactly what's going on, and you can see how many users, how many potential new patients are talking to AI, are getting engaged with AI, how many conversations are taking place, and how many consultation requests converted from those type of conversations. So it's very transparent, very user-friendly, both from the user perspective, your new patient perspective, as well as from your side, just understanding what does it do for you and why you should care. So when we automate the online engagement with AICareXpert, we basically achieve the following: 24 hours, 24/7 patient engagement with the 90% that you don't have visibility to today. So whether it's holiday, whether it's weekend, whether it's different time zones, whether you are looking to expand your practice, and one of our customers was looking to expand their practice into a global market, but they don't have the ability to hire more staff in 3 shifts to support different time zones in multiple languages, but they still want to be able to attract out of country patients. So this is where AICareXpert allowed them to scale up without making all of those huge investments, as there's no way to justify. 24 hours a day. So we are looking to increase conversion rates. I will give you specific example and data of what we are seeing with our other customers as far as how many we're actually able to engage with, how many actually convert. Emphatic Chat AI simplifies access to complex information. So you may think that you have all of the information on your website. So the 90% that is looking to gather information and to get educated on the treatment options, all of the information is out there, but also all the information is on other sites. Also, all of the information is on Google and maybe also on ChatGPT. So when they are on your website, when they are attending or joining your online presence, we want to engage with them. This is really what AICareXpert does. So one of the benefits for the patients and why they want to get engaged with AICareXpert is because instead of them browsing through 200 pages describing the different treatment options, the different lab tests that you offer, etc., descriptions, and all of that content, they can just open the chatbot, ask whatever questions they have, and AICareXpert will bring all of that information to them and answer their specific questions. That's why AI is becoming so prevalent and growing so fast. People are moving from, instead of chasing information, fetching information. So chasing information, that's I'm Googling and I'm reading pages of pages, getting redirected to multiple sites, etc., in an ocean of data, to fetching data, which is I'm saying what I need and I want that information to come to me. I don't want to just search manually and read through lots of content. In these days, no one actually has not the patience and not the time to do that properly. So this is why AI is so powerful. Reduces the workload on your staff because it automates all of the routine inquiries around the treatment options that you offer, the different programs, general questions about what you do, what you offer, what you don't offer. All of that knowledge is fed into AI. So this is not a general AI. As I said earlier, this is AI for healthcare. So we build this AI and train it specifically for healthcare. So there are certain behaviors that are unique to AICareXpert. And number 2, we also have the ability to incorporate a knowledge base based on your unique knowledge and information, and that all of the answers by AI are based on the combination of those two. Offers valuable analytics on visitors' behavior because for the first time you will know what the 90% of your patients, when they are in the earlier stages of their journey, are actually doing or looking for when they visit you online, which you have zero visibility to and zero engagement today, or nearly zero. I don't want to say zero, but almost zero. It's zero because there's no action. It doesn't convert to anything meaningful for you. Generate new clients within days of deployment. I covered that. So let's talk a little bit about emotional intelligence. So I mentioned a couple of times earlier emotional intelligence, and let me show you what does that actually look like. So with our emotional intelligence, we do two things. As I mentioned earlier, real-time emotion detection to adjust the conversation so that AI uses an emphatic tone and style and is able to match the state of mind of the patient when they are looking for information that can be very personal. They may going through some challenging times, etc. So this is very, very important. It can be robotic. So this is where we put a lot of development efforts into the emotional intelligence part of AICareXpert. The other thing that we do is we give you insights. So what you're seeing right now on the screen, those are reports that you have access to through the dashboard that shows you exactly for each conversation that took place, what was the detected emotional state of that patient before they became a patient during those conversations. And there's some interesting insights. And one of the things that you can do is even before the first scheduled appointment, you can go into the dashboard and you can see objectively how what AI detected as far as the emotional state of that new patient that you're going to meet with. And by the way, all of this information is also fed to you automatically. You don't have to go through this dashboard. We have the reports, we have the dashboard, we have the charts, we have all of these additional insights, but we also integrate into your own system. So if you have CRM or if you just want to have a Google spreadsheet, we did that as well with some of our customers where we just send all of the information there, including the sentiment detection around emotional intelligence state in conversation for each one of those conversations, especially those that schedule the consultations. So all of this information is fed to you, and you can see that we actually categorize the emotional state to 3 different categories, so it'll be easier for everyone to digest this data and make it meaningful and actionable. And those are negative, neutral, and positive. If you wonder what those are, we actually include the explanation in our dashboard. So you can see that on the top right-hand side of the screen, where positive indicates satisfaction, happiness, etc. Negative, dissatisfaction, frustration, sadness, and so on. And neutral, factual, objective. There's no strong signal of any specific emotion, and that's really what we do. And like I said earlier, all of this information is sent to you automatically. You don't have to go into our reports and see additional details here. Now let's talk a little bit about AI analytics. So we provide advanced analytics, which allows you to visualize all of the AI conversations that took place, so that for the first time, that those 90% that are in the beginning of their patient journey, that you have no clue what they're asking for, you have no clue what they're looking for the first time with AICareXpert, you will have that visibility. Why is that important? Well, that's important because you may want to reorganize the content on your social media, on your website. You may want to add some missing content that you don't have today on your website, because for the first time you will know what people are actually looking for, what they're asking for. So that will allow you to really be much more effective. That's extremely powerful intelligence with the way you approach, or how approachable online you look to the patients based on what they actually looking for. So that's extremely powerful. That's outside of the value of just getting new clients from the 90% of basically patient traffic that you have nearly zero visibility or engagement. So Unveil App people are actually looking for track the meeting requests generated by AI. So like I said earlier, this is a very transparent system. It's integrated into your system, so you don't have to open the dashboard, but this is updated in real time, and you will be able to see who scheduled appointments, how many, and all of the information, the conversations that took place, all of that. The most asked question report, we have the most asked question report. Many websites, many healthcare providers, they have FAQs on their website, and it seems to me that the FAQs may be based on experience and knowledge and just experience working with patients, but you may be surprised to see that the actual questions, the most frequently questions asked from visitors are very different than your FAQ, which is extremely interesting and also extremely powerful. So there's a lot of good information here that allows you to be so much more engaged and so much more effective throughout your entire practice, should you choose to take it to a next level. Emotional intelligence detection, we covered that earlier. In addition to that, we know that AI requires tuning. So as much as AI, we pre-train it specifically for healthcare. So this is not ChatGPT. This is not any off-the-shelf just AI that you can just drop and start off conversation and expect to get the same type of responses. It's completely different. However, we know there's always fine-tuning as just part of continuous learning. Also, the changes in your practice, you may be adding programs, changing programs, expiring programs, adding new treatments, etc. And we do have the ability to train AICareXpert on your unique offering, and we build a tuning and feedback system to make it extremely easy for you to report on tuning needs or tuning requirements. So it's a simple form. We include the conversations. All you have to do is just select the status of the report, put your comments, and we get notified automatically, and our team can take it from there and perform the tune-up as needed. So that's really important, and that's also the difference between a scalable, mature solution that can go all the way versus something that is not very scalable and not taking all of these things into consideration. Now let's talk about ROI, return on investment. So I'm going to use a case study from some of our customers. Actually, let's take this one, a fertility healthcare center. So going back to the funnel that we covered earlier, the patient journey funnel, starting with awareness, consideration, decision. So in this case, in their web traffic over a year period of time, they have about 51,000 plus users visiting the website, and those were originating from organic traffic. Their paid traffic doesn't go to the main website. They do have separate landing pages. So everything they generate on social media was not counted actually here. We only counted a subset of that traffic, which is visible to AI in this case. AI engaged with 2.7% out of those traffic, meaning that 2.7% of patients were going through the awareness, consideration, the discovery, the self-education phase, chose to engage with AI. So it's very easy to use that as a reference based on whatever number of users are visiting your online presence today, and you kind of start to get the realistic expectation on what AI can do specifically for you. Out of those, from that entire traffic, 0.41% converted to paid scheduled consultation requests. So those are basically the decisions. So In this case, over a 12 months projection, we are talking about more than 200 new patients generated just by adding AICareXpert on their website, basically, without changing anything. So it took them like their web admin, not the staff, 5 minutes to upload the code that we gave them. And once they did that, within days, they started to see new patients getting scheduled. And that's extremely powerful. It is something that you can have as well. So if we take an example using this customer data, and by the way, we have an ROI tool, so feel free to go to benderexpert.com/ROI and you can plug your own traffic information and the rest of the information there, and you can actually calculate what is the return of using AICareXpert based on your unique data. So if we'll take just as an example, 10,000 visitors per month as traffic, we know that we convert 0.4% from that traffic, and in this case, it's a US customer. The revenue from a single new patients, the average is $20K, and it may vary. Some are much higher. Some we see a range from $10K to $260K, but we chose here $20K, and the last number is the win rate, meaning how many from your consultation appointments are turning into new patients, are deciding to work with you, whether it's fertility treatments, detox, mental health, whatever the case may be. Not all of them, not all of those that scheduled and attended the appointments are converting into paid new patients. So we took a very conservative number here. Actually, our experience with one of our customers, the one that we use here, was 30%, was higher. But I think 20% is a more conservative number. So in this case, what you will be able to see is that once you install AICareXpert, AICareXpert, based on this data, will generate new revenue from those patients of $160,000 per month, which is almost $2 million in new revenue per year. Now, if your traffic is higher than 10,000 visitors per month, or your average sales price per patient is higher, then obviously those numbers will be very different. Or your close rate is higher than 20% conversions, then obviously these numbers will be very different, will be probably much higher. So this is really a very easy way to understand ROI, and something that you can do yourself as well using our tool here. Operational savings is something that is in addition to the direct conversion of bringing new clients from the 90% that are going through the patient journey. There's also very powerful value in operational savings because we are taking all of that load away from your staff. So your staff not likely to be able to scale, and under these numbers, considering the size of this fertility healthcare provider, they're not going to be able to engage with 270 people monthly. They just don't have the staff. The staff is busy doing other things. Plus, where the patients are at the beginning of their patient journey, they were not even ready to call anyone or to share their phone number or email. And with AI, they still were able to feel comfortable enough to engage and have those conversations without the stress or without feeling cornered, without feeling any pressure that someone is trying to basically push them to schedule an appointment when they are not ready for that just yet. So that's more than 3,000 prospects annually. That's a huge number. Now we do have also in our dashboard, should you decide to take a look at that, how many minutes were saved from all of those engagements by AI. So there's also another way to look at ROI here. One is the hard and straightforward, how many new patients I'm getting from AICareXpert on a monthly basis. Basically, this pays itself multiple times over. Before you need to pay anything for AICareXpert, you already gain new clients. And in addition to that, you have the operational savings because someone had all of those conversations, weekends, holidays, 24/7 in any time zone, and it wasn't your staff, it was AICareXpert. Now, let's talk about integration. I mentioned that briefly a few times, and I also showed you the dashboard, the reports. We fully integrate into your systems. We support integration with roughly 7,000 different applications. So we are quite confident that we can integrate with most of the applications out there, and some of the most common ones that we've used and we've seen with our customers: Google, Microsoft, HubSpot, other CRMs, Slack, etc. We do have integration with all of those so that whenever a new appointment is generated, we can either update your calendar directly, or we can notify a staff member, and or we can send them an email, and we can send an email to more than one person, a distribution list with the details of that new patient that requested an appointment following the engagement with the AICareXpert. All of that is fully integrated, so you don't have to train your staff to look at something that they are not used to, or introduce them to yet another application or another system. So we make it very, very user-friendly. Very easy to use. So when we think about the actual deployment, so the deployment is really in 5 steps. It's pretty straightforward. We start with a kickoff call just to understand the scope, what's unique to your practice that we need to fine-tune or take into consideration. We collect all of that information, and we basically build your AICareXpert instance on a test environment, in a safe environment outside of any of your systems, so that you will be able to fully test it and give us feedback. So if we need to make changes, fine-tune it, we can do that in a safe environment without any without any risk to your environment. And based on that feedback, we fine-tune. That's step number 3. And then we provide your web admin with the code. It's just a widget. Takes literally 5 minutes to install on your website. And once they do that, you are live, up and running, and you start to see AICareXpert generating new patient engagement activity on your behalf for you. The last piece, step number 5, is training. We do provide training to you and to your staff, to whoever needs to be part of this. And from there, we move into maintenance mode, where we monitor the health of the systems on the back end. You don't have to do anything. If there are any questions, we provide support, and we move to ongoing maintenance. And you can see all of the activity in real time, so you have the same visibility as us. We just maintain all of the subsystems, all of the integration points, etc. Compliance and privacy is something that I've been asked, especially in the US and also in Europe. And a quick comment that I would like to make here is really the way to think about AICareXpert. It's basically a chat, an AI-powered chatbot that sits on your website that inherits basically all of the privacy policies and the compliance policies from your existing website. So it's pretty straightforward. There's really no requirement for HIPAA compliance for that type of function. However, we know that we are in a regulated industry, and for that purpose, we do offer at additional charge 3 different levels of HIPAA compliance. We have at the basic level, advanced level, and premium level. If you are interested in adding any of those levels, we are more than happy to discuss with you the different options. But outside of that, we typically, at least up until now, we don't see our customers actually being required to add any additional policies. In some cases, and something we did do for some of our customers, we can mention or link your website privacy policy that you have on your website that's required, and link that inside of the chat. So just to reiterate that all of this information is subject to the privacy policy with the link to the privacy policy on the website. Again, it's just to be double safe, but there's no direct impact. From compliance perspective, if you have any concerns, then you should consult with your compliance advisor. I'm not a compliance advisor. I can only talk to best practices and what I'm seeing out there. And you can actually check yourself and go to any of your competitors on their website, and we can send you some examples, and you can see that really inside of a chat there's really rarely there's no mentioning of HIPAA whatsoever. The other thing that I want to mention here is that we don't integrate with EHR, electronic healthcare records. So by design, we don't want to create content, sensitive content about things that are sensitive, that are subject to HIPAA compliance, etc. We don't pull any information from your EHR systems. So it's only one way. It's outside of your EHR systems. And that's another way that allows us and allows you to make this deployment a breeze, very easy.